Some of the pills sitting in your medicine cabinet right now, the ones you swallow without a second thought, the ones your doctor prescribed years ago and never mentioned again, may be quietly starving your nerves and fogging your memory. And here's the part almost nobody tells you. After 60, when you start feeling that numbness in your feet, that word that sits on the tip of your tongue and won't come, that lightheaded moment when you stand up too fast, you assume it's just age. So you push through it, you don't mention it. And that silence is exactly the wrong thing to do, because some of these symptoms aren't aging at all. They're a side effect that's been building quietly for years, and once you know what to look for, you can do something about it. I'm a physician, and I've spent a long time sitting across from patients in their 60s, 70s, and 80s who came in worried they were losing their minds, when what they were really losing was the ability of their nerves and brain to work around the very medications meant to help them. So let me be very clear before we go one word further. Nothing I'm about to say is a reason to stop taking any medicine. Not one pill. This is education, not a prescription. Every drug on this list exists because it helps someone, and stopping suddenly can be far more dangerous than the side effect itself. What I want is for you to become an informed patient, someone who knows the right questions to ask your own doctor so the two of you can make smarter choices together. Here's my promise for the next few minutes. I'm going to walk you through 9 of the most common medications that can quietly affect your nerves and your brain after 60. For each one, I'll show you the simple science of why it happens, what the research actually says, and what I tell my own patients about timing, dose, and safer conversations to have. And stay with me all the way to the end, because the single most overlooked factor isn't any one of these drugs, it's what happens when several of them stack on top of each other. And it's the one almost nobody talks about. So let me set the stage with the science, because once you understand this, the whole list clicks into place. Your brain and your nerves run on chemical messengers. One of the most important for memory, attention, and learning is called acetylcholine. Think of it as the spark that lets one nerve talk to the next. A whole category of medications are what we call anticholinergic, meaning they block that spark. In a younger body, there's plenty of acetylcholine to spare, so you barely notice. But after 60, your natural levels drop and the protective barrier around your brain gets a little leakier, letting more of these drugs cross in. So the same pill that did nothing to you at 40 can cloud your thinking at 70. On top of that, some drugs quietly drain vitamin B12, the vitamin your nerves need to keep their protective coating intact, and others change blood flow or nerve signaling directly, memory and balance. That's the thread running through everything today. Now let's get to the list. Number 1, sleep aids. I'm talking about the over-the-counter ones you buy without a prescription, the PM versions of pain relievers, the ones with diphenhydramine in them. Here's the twist most people never realize. That ingredient is a powerful anticholinergic. It's the same drug family that blocks your memory spark. There was a landmark study published in JAMA Internal Medicine that followed thousands of older adults for years and found that higher cumulative use of strong anticholinergic drugs was linked to a significantly greater risk of dementia. What I tell my patients is this: if you're reaching for a PM sleep aid more than once in a while, that's a conversation to have with your doctor about safer sleep strategies. The caveat: occasional use is not the same as nightly use, so don't panic if you've taken one now and then. It's the steady night after night habit that adds up. Number 2, and it's closely related, allergy medications, the older antihistamines. Diphenhydramine again, and its cousins, the classic pink allergy pills, the ones for itching and hives. Same mechanism, same blocking of acetylcholine, same fog. The research groups these right alongside the sleep aids because chemically they're nearly identical. What I tell my patients is that there are newer, second-generation allergy medicines that don't cross into the brain nearly as easily. They were specifically designed not to. So if you take something daily for allergies, ask whether a newer option makes sense for you. The caveat: everyone's different, and some people genuinely need the older drugs for specific reasons, which is exactly why this is a doctor conversation and not a do-it-yourself switch. Number 3, medications for an overactive bladder. If you get up several times a night or you've been prescribed something for urgency, many of those drugs are also anticholinergic, the very same family. And here's what worries me most about this one. They add fall risk on top of the fog. When your acetylcholine is blocked, your balance and reaction times suffer, and a fall at 75 is not a small thing. Studies on older adults have repeatedly tied high anticholinergic load to both confusion and falls. What I tell my patients is that there are newer bladder medications that work through a different pathway and don't carry the same brain burden. Worth asking about. The caveat, as always, never just stop because the underlying problem doesn't go away on its own. Now we shift to a different mechanism entirely, the B12 story. Number 4, acid reflux medications, the ones we call proton pump inhibitors, the dashproazole drugs. Millions of people over 60 take them, often for years, sometimes long after they even needed to. Here's the science. Your stomach acid is what lets you absorb vitamin B12 from food. Shut that acid down for years, and your B12 can slowly fall. And low B12 shows up as exactly the symptoms people blame on age: numbness and tingling in the hands and feet, unsteadiness, even memory trouble. Research in journals like JAMA has linked long-term use of these drugs to B12 deficiency. What I tell my patients is simple. If you've been on one of these for more than a couple of years, ask your doctor to check your B12 level. It's a cheap blood test. The caveat: for many people, these drugs are genuinely necessary, so the answer is monitoring, not stopping. Number 5, metformin, one of the most common medications for type 2 diabetes. It's a good drug, a genuinely helpful drug, but it too can lower B12 over time through a different route in the gut. And in someone whose nerves are already stressed by diabetes, that extra B12 drop can tip them into neuropathy, that burning, tingling, numb sensation in the feet. The American Diabetes Association actually recommends periodic B12 checks for people on long-term metformin precisely because of this. What I tell my patients is that this is one of the easiest problems to catch and fix. A simple supplement often handles it once your doctor confirms the deficiency. The caveat: metformin is protecting you in important ways, so this is about adding a B12 check, never about dropping the medicine. Number 6, certain blood pressure medications. Now, controlling blood pressure is one of the best things you can do for your brain long term. I want to be crystal clear about that. But some of these drugs, particularly when the dose is a little too high for an older body, can drop your pressure too far when you stand up. That's called orthostatic hypotension, and it means less blood, less oxygen reaching the brain for a few seconds. You feel dizzy, foggy, unsteady, and again, people blame their age. What I tell my patients is to mention it if you feel lightheaded standing up, because often it's a matter of adjusting the dose or the timing, not abandoning treatment. The caveat is enormous here. Uncontrolled blood pressure is far more dangerous to your brain than the dizziness, so this is a fine-tuning conversation. Now to the last 3, and these are the ones people least expect. Number 7, statins, the cholesterol medications. This one is genuinely debated in medicine, and I want to be honest with you about that. A small number of patients report memory fog or muscle-related nerve symptoms on statins, and the labels do mention reversible memory effects. What the large studies show, though, is that for most people, the heart and stroke benefits far outweigh this, and the fog, when it happens, usually clears if the medication is changed. What I tell my patients is, if you started a statin and truly noticed your thinking change, don't suffer silently and don't quit on your own. Tell your doctor, because there are several different statins and doses, and switching often solves it. The caveat: for someone at real cardiovascular risk, a statin may be saving your life, so we adjust, we don't abandon. Number 8, benzodiazepines, the anti-anxiety and sometimes sleep medications, the PAM drugs. These are among the most concerning on the entire list for the aging brain. They slow the whole nervous system down, and in older adults they linger far longer than they used to because your body clears them more slowly. The result is sedation, memory gaps, confusion, and a real increase in falls. Major geriatric guidelines, the Beers criteria that we physicians actually use, flag these as drugs to avoid or minimize in older adults for exactly this reason. What I tell my patients is that if you've been on one of these for a long time, there are careful, slow, doctor-supervised ways to reduce them, and I emphasize slow and supervised. because stopping a benzodiazepine abruptly can be genuinely dangerous. That's the caveat, and it's a serious one. Never taper these without your doctor. Number 9. The one almost nobody talks about: certain mood and nerve pain medications. Some older antidepressants, the tricyclics, are strongly anticholinergic, right back to that memory-blocking family. And some medications prescribed for nerve pain itself can, at higher doses in older adults, cause the very drowsiness, unsteadiness, and fog people assume is aging. The irony isn't lost on me. A drug for nerve pain contributing to nerve-related symptoms. What I tell my patients is that this category has grown so much that there are almost always alternatives with a gentler profile for the aging brain. The caveat: mood and pain conditions are real and deserve treatment, so this is about finding the right fit, not going without. Now here is the single most overlooked factor, the thing I promised you at the start. It's not any one of these 9 drugs on its own. It's the stacking. Look back at that list. A nightly sleep aid, a daily allergy pill, a bladder medication, an old antidepressant. Each one alone might be tolerable, but 3 or 4 anticholinergic drugs together create what we call a cumulative anticholinergic burden. And that total load is what the research ties most strongly to memory decline and falls. Most people never add it up because each pill was prescribed by a different doctor for a different reason, and no one is looking at the whole pile at once. That's the gap, and you can close it. So here is what to actually do, and none of it involves stopping a single medication on your own. Gather every pill you take, prescription and over-the-counter, and bring the whole collection to your doctor or pharmacist. Ask them one powerful question: do any of these have anticholinergic effects? And is my total load too high? Ask whether your B12 has been checked if you're on acid reducers or metformin. Ask whether any older medication has a newer, brain-safer alternative. And ask whether the dose that was right for you 10 years ago is still right for your body today. Those 5 questions, asked out loud, can change everything, and they cost you nothing but the courage to raise them. Because the truth is, growing older does not mean quietly accepting a foggy mind and numb feet as your fate. Sometimes what looks like aging is simply a conversation you haven't had yet. So have it. Bring your list, ask your questions, and partner with the doctor who knows you. Your brain and your nerves have carried you this far. They're worth protecting for every year still ahead.